Welcome to Group 4's presentation on Dorothy Johnson. My name is Jennifer, and I will give you an introduction on what Johnson believed in. Dorothy Johnson was a nursing theorist who was born on August 21, 1919. She has had an influence on nursing through her publications since the 1950s. Throughout Johnson's career, she has stressed the importance of research-based knowledge about the effect of nursing care on patients. This led to the Johnson Behavioral System model, in which she came up with in 1980. As we have been learning, nursing theories are used to describe, develop, and use present knowledge in nursing. Johnson was an early believer of nursing as a science as well as an art. In 1961, Johnson proposed that nursing care facilitated the client's maintenance of a state of balance. Johnson proposed that clients were stressed by a stimulus of either an internal or external nature. These stressful stimuli created such disturbances or tensions in the patient that a state of imbalance occurred. This will be illustrated in the case scenario that is to follow. Johnson's behavioral system model springs from Nightingale's belief that nursing's goal is to help clients prevent or recover from disease or injury. So, the science and art of nursing should focus on the patient as an individual and not on the specific disease. Johnson believes that nurses should use the behavioral system as their knowledge base instead of the biological system that physicians use as their base knowledge. Johnson chose the behavioral system model because she believes that all the patterned, repetitive, purposeful ways of behaving that characterized each person's life make up an organized and integrated whole or a system. She also believes that by categorizing behaviors, they can be predicted and ordered.
Major concepts of the theory. It has two major systems, the biological system and the behavioral system, wherein the client is seen as a collection of behavioral subsystems that interrelate to form the behavioral system. Her theory focuses the client in potential or actual illness situations. Nursing has a primary goal in her theory, that is to foster equilibrium within the individual. Nursing is concerned with the organized and integrated whole, but the major focus is on maintaining a balance in the behavior system when illness occurs in an individual. Fundamental ideas about the theory. First is the attachment affiliative subsystem, the most critical because it forms the basis for all social organization. It provides survival and security. Its consequences are social inclusion, intimacy and formation, and maintenance of a strong social bond. Dependency subsystem. It promotes helping behavior that calls for a nurturing response. Its consequences are approval, attention or recognition, and physical assistance. A certain amount of interdependence is essential for the survival of social groups. Next is ingestive subsystem. It has to do with when, how, what, how much, and under what conditions we eat. It serves the broad function of appetitive satisfaction. This behavior is associated with social, psychological, and biological considerations. Eliminative subsystem. It addresses when, how, and under what conditions we eliminate. The social and psychological factors are viewed as influencing the biological aspects of this subsystem and may be, at times, in conflict with the eliminative subsystem. Next is sexual subsystem. It has the dual functions of procreation and gratification, including but not limited to courting and mating. This response system begins with the development of gender role identity and includes the broad range of sex role behaviors. Aggressive protective subsystem function is protection and preservation. This follows the line of thinking of ethologists, rather than the behavioral reinforcement school of thought which contends that aggressive behavior is not only learned but has a primary intent to harm others. Achievement subsystem. It attempts to manipulate the environment. Its function is control or mastery of an aspect of self or environment to some standard of excellence. Areas of achievement behavior include intellectual, physical, creative, mechanical, and social skills. 4 assumptions of the system. First, there is organization, interaction, interdependency, and integration of the parts and elements of behaviors that go to make up the system. Second, a system tends to achieve a balance among the various forces operating within and upon it, and that man strives continually to maintain a behavioral system balance and steady state by more or less automatic adjustments and adaptations to the natural forces impinging upon him. Third, a behavioral system which both requires and results in some degree of regularity and constancy in behavior is essential to man. That is to say, it is functionally significant in that it serves a useful purpose, both in social life and for the individual. Lastly, system balance reflects adjustments and adaptations that are successful in some way and to some degree. Assumptions about structure and function. From the form the behavior takes and the consequences it achieves can be inferred what drive has been stimulated or what goal is being sought. Each individual has a predisposition to act with reference to the goal in certain ways rather than the other ways, and it is called a set. Third, each subsystem has a repertoire of choices or scope of action. Fourth is that the patient produces observable outcome that can be observed. Each subsystem has 3 functional requirements. System must be protected from noxious influences with which systems cannot cope. Each subsystem must be nurtured through the input of appropriate supplies from the environment, and each subsystem must be stimulated for use to enhance growth and prevent stagnation.
Hi, I'm Cecilia. I'm here to talk about how does Johnson's behavioral system model relates to the 21st century nursing practice. According to Alligood in 2014, Johnson's theory guides nursing practice, education, and research, generates new ideas about nursing, and differentiates nursing from other health professions. By focusing on behavior rather than biology, the theory clearly differentiates nursing from medicine, although the concepts overlap with those of the psychosocial professions. Johnson's behavioral system model provides a conceptual framework for nursing education, practice, and research. The theory has directed questions for nursing research. It has been analyzed and judged appropriately as a basis for the development of a nursing curriculum. Practitioners and patients have judged the resulting nursing actions to be satisfactory. The theory has a potential for continued utility in nursing to achieve valued nursing goals. Anna Marquez, a 21-year-old female married client, was rushed to the hospital. She was experiencing a sharp stabbing pain in her lower right abdomen radiating to her right shoulder and neck. Heavy vaginal bleeding, weakness, dizziness were also observed. She was at work when the incident happened. The ultrasound test showed a gestational sac with signs of rupture. The patient was admitted to the hospital with a diagnosis of ectopic pregnancy. Her medical history revealed that she has type 1 diabetes. She had been injecting insulin for 3 years. The patient was accompanied by her husband during hospital stay and answered most of the questions. Anna kept on blaming herself for what happened. The couple did not use any form of contraceptive as Anna wanted to have a child of their own. She is the youngest in the family with 4 other siblings. She is brought up with Christian values. Anna loves children and teaching is her passion. She graduated with a BA in Early Childhood Studies from a university. Anna currently works as a full-time kindergarten teacher in the rural community. Her husband described her as the sweetest person on earth. They had been living together for 2 years and her husband works in the hospital as a full-time registered nurse. Surgical treatment, laparoscopy with self-injectomy was performed urgently. After the operation, she complained of painful urination with mild bleeding and showing signs and symptoms of depression. She did not want to eat, drink, and perform self-care. She refused to entertain visitors and friends. She is only allowed her family to visit her. When asked by the nurses, she would shout at them and telling them to leave her alone.
Using Johnson's 7 subsystems, we will now look at the client assessment, attachment affiliative. The patient is married, She has many friends both from work and church. Dependency. Anna refused to answer when being interviewed by the staff nurse. Her husband answers the questions and reports that she's living independently with him. She started to refuse taking care of herself after the operation. Her husband is always by her side whenever she needed something, especially when taking care of herself, like taking a shower. Ingestive. Anna has type 1 diabetes and is on a diabetic diet. According to her husband, she usually cooks food at home that are low salt and refrains from eating sweets. Anna might experience weight loss as a client refuses to eat and drink during her hospital stay. Eliminative. Anna is complaining of painful urination with mild bleeding and it bothers her. She is currently wearing sanitary pads for mild vaginal bleeding. She is teary-eyed and blames herself for letting these things to happen. Sexual. Anna always wants to have a child of their own and to become a mother. Since she had an ectopic pregnancy, they might have concerns about her future pregnancies. The couple never used any other forms of contraceptives, as reported by her husband. Achievement. Anna has achieved many developmental goals of adulthood. She graduated with a BA in Early Childhood Studies and is currently working as a full-time kindergarten school teacher. She's starting to care for herself. Daily activities like bathing and grooming. Aggressive protective. Anna is feeling depressed. Her emotional well-being is being challenged. Her ectopic pregnancy is seen as a failure resulting in a disruption of her equilibrium. Refusing to eat, drink, and shouting as a means of regaining control.
Environmental assessment. As per Dorothy Johnson's behavioral system model, an assessment of the environmental is vital. Looking at this case study, there are several internal and external environmental factors creating stress and tension, ultimately disrupting the behavioral system regarding its balance and stability, leading to observable outcomes. Anna comes from a large Christian family, as she is the youngest of 4 other siblings. She loves children and teaching, which inspired her to graduate with a Bachelor of Arts in Early Childhood Studies. She now works as a kindergarten teacher in a rural community. Her husband of 2 years and Anna never used any form of contraception in the hopes to have a child of their own. The diagnostic imaging, surgery, and hospitalization has increased Anna's stress, which increases one's blood sugar. Thus, it must be managed well as she is a type 1 diabetic. Post-laparoscopy with salpingectomy has produced many impairments regarding her mental health, socialization, self-care, maturity, and nutrition. She displays signs and symptoms of depression as she is not eating or drinking as well as not taking care of herself. She refuses to entertain her visitors and shouts at nurses, telling them to leave her alone. Anna's approach to this hospitalization post-surgery is certainly detrimental to her mental health, especially when she's crying and blaming herself for what has happened. She was previously described as the sweetest person on earth by her husband, but this stress has certainly affected her mental state, producing an observable, harsh emotional state. Her nurses, husband, and family must continue to aid and improve Anna's mental well-being by helping to restore stability to her environment. With Anna's environment being in a hospital setting, it has placed Anna in a vulnerable position. The salpingectomy may decrease her chances of having a child of her own, further impacting her future goals. This event has certainly disrupted her balance and stability in the behavioral system, producing a great amount of stress and tension. Looking at this case study, there are several internal and external environmental factors creating stress and tension, ultimately disrupting the behavioral system regarding its balance and stability, leading to observable outcomes. For the internal environment factors, we must look at biological, pathological, psychological, developmental, and level of wellness. Biologically, our subject is female and 21 years old. Pathologically, she has type 1 diabetes mellitus, where her pancreas does not produce insulin. Psychologically, she has always had hope to have a child of her own. Developmentally, she is well educated as she has graduated with a Bachelor's of Arts Early Childhood Studies from a university. Last but not the least, her level of wellness is great as she's been managing her type 1 diabetes well
with 3 injections a day. For the external environmental factors, we must look at cultural, ecological, familial, and sociological factors. Culturally, she has Christian values. Ecologically, she lives in a rural community. Familially, she is the youngest of the 4 other siblings and she is married. And lastly, sociologically, she works as a kindergarten teacher who loves children and is extremely social. Looking as a whole, this event has certainly disrupted her balance and stability in the behavioral system, producing a great amount of stress and tension.
Hello, my name is Irami, and I'm doing a report on nursing interventions and rationale about the case of Anna using Dorothy Johnson's behavioral system model. First priority would be self-care independence. We should provide understanding about the disease and approaches about self-care to give awareness to Anna. Also assist the patient to cope with her everyday life to effectively manage or fulfill her tasks to involve her in daily decision-making, and educate new skills to enhance health and personal growth. Second intervention would be fear of future pregnancy. We should discuss the situation with the patient and help differentiate between real and imagined threats to well-being. This approach helps the patient deal with fear and also maintain a relaxed and accepting demeanor while communicating with the patient. This will increase a peaceful and non-threatening environment. Next is functional physical dependence. We should present positive reinforcement for all activities attempted to promote ongoing efforts, but make sure to check patient from time to time as they tend to be weak and slow in progress. Also, we should establish realistic short-term goals to reduce frustration. For refusing visitors, we should actively listen to Anna's feelings and concerns to provide respect and human dignity. Next is for painful urination with mild bleeding. Administration of antibiotics or analgesics is ordered to provide comfort and relief. Lastly, to intervene about blaming herself, we should use presence, touch with permission, verbalization, and demeanor to remind patient that they are not alone and to encourage expression or clarification of needs, concerns, unknowns, and questions. Being supportive and approachable promotes communication.
Client's goal. According to nursing theory in 2011, implementation of nursing care related to diagnosis may be difficult because of lack of client's input into the plan. The plan will focus on client's action to modify client's behavior, which focus more on a plan rather than a goal. To bring about homeostasis in the subsystem, should be based on nursing assessment of the individual, drive, set behavior repertoire, and observable behavior. The plan may include protection, nurturance, or stimulation of the identified subsystem. Using the Johnson's behavioral model, the drive or goal will be Anna wants to have a child. She is eager to start her own family. She wants to consult a fertility doctor later on to plan her future pregnancy. Judging from her situation, it appears that it's important for her to find her own strength. Her husband is supportive of her goals and aspiration. The couple made their decisions to build a family together. It is evident for the patient likes being with children. She is sensitive about the idea of having a child. She usually confides with her husband her decisions regarding their family choice. Although it took some time for the patient to accept the situation, she is no longer in pain and has minimal vaginal bleeding. She focused on taking care of herself and preparing her body for future plans of conceiving. She has started to do self-care activities and asked the staff for assistance. She is interested in attending support programs available in the community. Actions. The patient has started to entertain her family and visitors. She now welcomes people from her work. She solicits prayers from her fellow church members and asks for hospital chaplain for spiritual guidance. Whenever she has any inquiry or needs assistance with activities such as standing and walking, she courteously asks the staff.
Hi all, I'm Preetu and I would like to discuss about the client evaluation. Evaluation is based on the attainment of a goal of balance in the identified subsystems. If the baseline data are available for an individual, the nurse may have goal for the individual to return to the baseline behavior. If the alteration in the behavior that are planned to do occur, the nurse should be able to observe the return to the previous behavior patterns. Johnson's behavior model with the nursing process is a nurse-centered activity, with the nurse determining the client's needs and state behavior appropriate for that need. A rupture ectopic can be life-threatening situation and symptoms are not always typical and should be ruled out in any woman of childbearing age who might be pregnant and presenting with a lower abdominal pain and scanty dark red bleeding. The nurse should evaluate to see whether the goals have been partially or fully met. Also review whether the plan be revised or continued. So friends, Johnson's behavior system model is a model of nursing care that educates the fostering of efficient and effective behavior functioning in the patient to prevent illness. It describes the patient as a behavior system with 7 subsystems: the achievement, attachment, affiliation, aggressive, protective, dependency, ingestive, eliminative, and sexual subsystems. Each subsystem is interrelated with others and the environment and specific structural elements and functions that help maintain the integrity of the behavior system. When the behavior system has balance and stability, the individual's behavior will be purposeful, organized, and predictable. Imbalance and instability in the behavior system occurs when tensions and stresses affect the relationship of the subsystems or the internal and external environment. As nursing professionals, we must be prepared to articulate our discrete body of knowledge to ourselves, to other care professionals, and to the public. We should know that what we are doing as a nurse and moreover why we are doing to reflect on our practice by identifying the theoretical basis of our practice. Remember, the future is here. Please review the references. Thank you all for the listening.